I've had men sit across from me in my clinic, looking exhausted, frustrated, sometimes even embarrassed. They tell me they're waking up 4, 5 times a night to use the bathroom. They talk about the constant urgency, the discomfort, the feeling that their own body is betraying them. And here's what breaks my heart. Most of them think this is just part of getting older, that once you hit 50, 60, or 70, you're supposed to accept a life of interrupted sleep, bathroom anxiety, and quietly suffering in silence. But I'm here to tell you something important that's not true. I'm Dr. Jocelyn, and over the past 5 years working with men dealing with prostate issues, I've seen something remarkable. The men who make small, specific changes, not drastic overhauls, just smart, intentional shifts, they get their lives back. They sleep through the night, they feel confident again. They stop planning their day around where the nearest restroom is. Now, before we dive in, I want you to do me a favor. If you're watching this because you're dealing with prostate problems or you just want to protect yourself as you age, drop a comment and let me know where you're watching from. I read every single one, and it helps me understand who I'm talking to. And if this information helps you, hit that like button. It tells YouTube to share this with more men who need it. All right, let's get into it. Here's something you probably haven't heard before. Your prostate doesn't just enlarge because of age. Sure, age is a factor. But what's really happening inside your body is a silent cascade of inflammation, hormonal imbalance, and poor circulation. And most of it is triggered by habits you repeat every single day without even realizing the damage. Think about it like this. Your prostate is about the size of a walnut, sitting right below your bladder, wrapping around your urethra. When it's healthy, you don't even know it's there. But when it starts to swell, even just a little, it squeezes that urethra like a garden hose being pinched. Suddenly, urination becomes difficult, painful, frustrating, and here's the kicker, most men are unknowingly feeding that inflammation every single day. You're not broken, you're not too old, you've just been doing a few things wrong. And the good news? Once you understand what those things are, you can start fixing them today. So in this video, I'm going to walk you through the 7 deadliest habits that are quietly destroying your prostate. These aren't random tips. These are the exact patterns I see over and over in my clinic, the habits that separate the men who suffer for years from the men who take control and feel like themselves again. By the end, you'll know exactly what to avoid, what to start doing, and why these changes matter on a biological level. Let's go. Habit hazone, sitting for hours without moving. I know. You've heard it before, sitting is the new smoking. But let me tell you why this is absolutely devastating for your prostate, because once you understand what's happening inside your body, you'll never ignore this again. When you sit for long periods, whether it's at a desk, in a car, or on the couch watching TV, you're putting direct, constant pressure on your prostate. Imagine squeezing a sponge for hours. That's what's happening. Blood flow to the area slows down. Oxygen delivery drops. Inflammation quietly builds. And here's what most men don't realize. Poor circulation to the prostate creates the perfect environment for it to swell. Your body can't clear out metabolic waste properly. Toxins accumulate, the tissue becomes irritated, and over time, that irritation turns into chronic enlargement. I had a patient mid-60 seconds, retired truck driver. He'd been dealing with prostate issues for years. Medications weren't helping much. When I asked about his daily routine, it hit me. He was sitting 10 to 12 hours a day. Driving, watching TV, eating meals, always sitting. I told him, every hour I want you to stand up and walk for just 2 minutes. That's it, just 2 minutes. He looked at me like I was crazy, but he tried it. And within 3 weeks, he noticed a difference. Less urgency, fewer nighttime trips. Why? Because we restored blood flow. We gave his prostate room to breathe. So here's your action step. Set a timer. Every 60 minutes, stand up and move. Walk around the house, do some light stretches. Even just standing and shifting your weight helps. Your prostate will thank you. Habit #2, ignoring hydration or drinking the wrong things. Now, this one's tricky because it seems contradictory. Men with prostate problems often think, if I drink less, I'll have to pee less. And on the surface, that makes sense. But in reality, dehydration makes everything worse. When you're dehydrated, your urine becomes concentrated. More concentrated urine irritates the bladder and urethra, which makes that urge to go even more intense. Plus, your body can't flush out bacteria and inflammatory compounds efficiently, so they sit in your urinary tract, causing more problems. But here's the other side of the coin. What you drink matters just as much as how much you drink. If you're loading up on coffee, energy drinks, or alcohol, you're pouring fuel on the fire. Caffeine and alcohol are both diuretics. They make you pee more and they irritate the bladder lining. So you're stuck in this vicious cycle. You're thirsty, you drink something that makes you pee more, your bladder gets irritated, and you feel even worse. Here's what I tell my patients. Drink water consistently throughout the day, but taper off in the evening. Aim for about 6 to 8 glasses during daylight hours. Then, starting around 2 hours before bed, slow it down. Maybe just small sips if you're thirsty. And if you're a coffee lover, and trust me, I get it, limit yourself to 1 or 2 cups in the morning. Afternoon, switch to water or herbal tea. Your bladder will calm down and you'll sleep better. Habit #3, eating inflammatory foods every single day. All right, let's talk about food, because this is where I see men sabotage themselves without even knowing it. Your prostate is incredibly sensitive to inflammation. And certain foods you're probably eating regularly, are quietly inflaming your entire body, including that walnut-sized gland. I'm talking about processed meats, fried foods, excess red meat, refined sugars, and white bread. These foods spike your insulin, increase oxidative stress, and trigger inflammatory pathways that go straight to your prostate. Let me explain what's happening biologically. When you eat a diet high in these foods, your body produces more of something called prostaglandins. These are compounds that promote inflammation. Over time, chronic inflammation damages prostate tissue, encourages cell overgrowth, and worsens urinary symptoms. Now, I'm not saying you can never have a steak or a burger, but if your daily routine looks like fast food for lunch, processed snacks in the afternoon, and fried chicken for dinner, your prostate is drowning in inflammation. Here's the flip side. Anti-inflammatory foods can actually help shrink prostate swelling. Foods like fatty fish, salmon, sardines, leafy greens, tomatoes, rich in lycopene, nuts, seeds, and berries, these are prostate protectors. One of my patients made a simple swap. He replaced his usual bacon and eggs breakfast with oatmeal, blueberries, and walnuts. He cut back on red meat and started eating fish twice a week. Within a month, his nighttime bathroom trips dropped from 5 to 2. So here's your challenge. This week, add 1 anti-inflammatory food to your daily routine. Just 1. A handful of walnuts, a serving of salmon, a cup of green tea. Start small. Your prostate will respond. Habit #4, holding your urine too long. This one's common, and I get it. You're in the middle of something, a meeting, a drive, a TV show, you don't want to pause. So you hold it. I'll go in a few minutes, you tell yourself. But here's what's happening inside your body. When you consistently hold your urine, you're overstretching your bladder. Over time, this weakens the bladder muscle, making it harder to empty completely. And when your bladder doesn't empty fully, residual urine sits there, creating a breeding ground for bacteria and irritation. Plus, holding it puts extra pressure on your prostate. Remember, your prostate wraps around your urethra. When your bladder is full and pressing down, it's compressing the prostate even more. That constant pressure leads to inflammation and worsens symptoms. I had a patient who worked in security long shifts, couldn't always leave his post. He'd hold his urine for hours. Eventually, he developed chronic prostate inflammation and recurrent urinary tract infections. We worked on a simple strategy. Go when you first feel the urge. Don't wait until it's unbearable. Train your body to empty regularly, even if the urge isn't intense yet. And here's a bonus tip. When you do go, take your time. Don't rush. Let your bladder empty completely. Sometimes men are in such a hurry they don't fully void, and that leftover urine causes problems. Habit #5, living under constant stress. Now, this one might surprise you, but chronic, unmanaged stress is one of the most underrated contributors to prostate problems. Here's why. When you're stressed, your body releases cortisol and adrenaline. These hormones put you in fight or flight mode. Your muscles tense up, including the muscles around your prostate and bladder. This tension restricts blood flow, increases inflammation, and can even make it harder to urinate. Ever notice that when you're anxious or stressed, your urinary symptoms get worse? That's not a coincidence. Your nervous system is directly connected to your bladder and prostate function. I've seen men whose symptoms improved dramatically just by learning to manage stress. One patient started doing 10 minutes of deep breathing every morning. Another took up light yoga. Nothing intense, just gentle movement and mindfulness. And you know what happened? Their urgency decreased, their nighttime trips reduced. Why? Because they gave their nervous system a chance to relax, which allowed their pelvic muscles to relax, which improved urine flow. So here's what I want you to try. Find 5 minutes a day to just breathe. Sit quietly. Close your eyes. Breathe in slowly through your nose. Hold for a few seconds. Exhale through your mouth. Do this for 5 minutes. It sounds too simple to work, but it does. Your prostate isn't just a physical organ. It's connected to your emotional state. Take care of your mind, and your body will follow. Habit #6, skipping exercise, especially lower body movement. Let's be honest, as we get older, it's easy to slow down. Maybe your knees hurt, maybe you're tired, maybe you just don't feel like moving the way you used to. But here's the hard truth. A sedentary lifestyle is poison for your prostate. Exercise does 3 critical things for prostate health. It improves circulation. Better blood flow means more oxygen and nutrients reach your prostate, helping it stay healthy and reducing inflammation. It helps regulate hormones. Exercise balances testosterone and estrogen levels, which directly impact prostate size. It strengthens your pelvic floor. The muscles that support your bladder and prostate need to stay strong. Weak pelvic muscles equals poor bladder control. Now, I'm not saying you need to run marathons, but you do need to move. Even moderate activity, walking 30 minutes a day, doing bodyweight squats, light stretching makes a massive difference. I had a patient in his early 70 seconds, retired, barely moving. His prostate symptoms were terrible. I convinced him to start walking around his neighborhood every morning, just 20 minutes at first. Then we added some gentle squats and stretches. Within 2 months, he told me he felt like a different person. More energy, better sleep, fewer bathroom trips. So here's your action step. Move your body for at least 20 minutes a day. Walk, stretch, do some squats. Just move. Your prostate and your overall health will transform. Habit #7, ignoring the early warning signs. This is the most dangerous habit of all, because by the time most men come see me, they've been ignoring symptoms for years. They tell themselves, it's not that bad, or I'll deal with it later, or it's just old age. And meanwhile, the problem gets worse. The prostate continues to swell, the symptoms intensify, and what could have been managed with simple lifestyle changes now requires medication or even surgery. Here's what I need you to understand. Your prostate is giving you signals. Frequent urination, weak stream, urgency, difficulty starting or stopping, nighttime bathroom trips. These aren't things you should just accept. These are your body's way of saying, hey, something's wrong, pay attention. I've seen men wait so long that they develop complications, bladder stones, infections, kidney damage, and all of it could have been prevented if they'd just taken action earlier. So if you're experiencing any of these symptoms, even if they're mild, don't ignore them. Talk to your doctor, get checked, and start making the changes we've talked about today. Because here's the truth. The earlier you act, the easier it is to fix. All right, let's bring this all together. I've given you a lot of information, but I don't want you to feel overwhelmed. You don't need to change everything overnight. Here's what I want you to do. This week, pick TWO habits from this list and start working on them. Maybe it's drinking more water and moving every hour. Maybe it's cutting back on processed foods and managing stress. Just 2. Master those. Let them become part of your routine. Then, in a few weeks, add another one. Small changes compound, and over time, they lead to massive improvements in how you feel. If this video helped you, do me a favor, hit that subscribe button and turn on notifications. I release new videos every week specifically for men who want to age with strength, dignity, and vitality. And drop a comment below. Let me know which habit you're going to tackle first. I read every comment and I'll be there to cheer you on. Remember this, age is not a disease. You don't have to accept discomfort, sleepless nights, or embarrassment as your new normal. You have more control than you think. Your prostate health is in your hands, and the changes you make today will define how you feel tomorrow. I'm Dr. Jocelyn, and I believe in you. Now go take care of yourself. I'll see you in the next one.